I'd like to ask you as an introduction, what has been GAIN's role during this 6 or 7 months of COVID? What did actually GAIN do, especially with regard to India?
Sir, overall, COVID obviously is a global phenomenon. It has impacted all of us. As GAIN and with our partners across the globe and in India, we've assessed this at four different levels. One is you've had severe disruption in income, and income for the most vulnerable is most severely impacted. So people who are already vulnerable are impacted the most. Second, food supply chains, fortunately not that much in India, but globally we've seen in other parts of the world, there has been disruption in food supply chains. Some of that we saw in the early days in India as well. And normally when you have disruptions in food supply chains because of a variety of lockdowns and opening of these lockdowns, it's the fresh fruits and vegetables, the more nutritious foods are perishable, and that is where the impact is more. And therefore, combining these two, it is expected that the poorer and more vulnerable section of society defaults towards staple diets. Third is obviously our primary healthcare systems have also been impacted at some level. And with the announcement of various schemes, the rejigging of social protection schemes by the government, I believe some of our social protection schemes have also been tested because of the strain on them. So I think collectively as a country, this has been our challenge, and GAIN in some states has provided very direct relief to migrant workers and workforces working in tea gardens and plantations, and migrant workers in Bihar, in Karnataka, in UP, etc. But broadly speaking, I think our message through all our partnerships is the default towards more consumption of staple foods in times of such pandemics. We must continue our large-scale food fortification work, which all development partners, not only GAIN, all development partners have been doing so responsibly and so much in coordination, not only in the private sector, but also the public sector with the social protection scheme. We should not get that interrupted.
It was a survey done by a group of civil society organizations, which surveyed about 5,000 plus rural households across 12 states in India. And they found that more than half of them were found to be eating fewer items than before, and especially to overcome the crisis. So what is your comment on that?
Oh, absolutely. This goes back to what I was mentioning. In a classical diet and, addressing malnutrition, we say a diversified diet is the gold standard and have as many foods. And in the reality of our country and many parts of the world, we know that a good diversified diet is not at all times affordable, particularly at times when the vulnerable section of society has had an income shock, and there is an availability shock as well. And so I'm not surprised at all at the observation that people were accessing and affording. So there are two components to this. Access was lower, affordability was also lower, and therefore diets were going more towards staples than towards what we would call even a reasonably diversified nutritious offering.
Yes, Poshan Abyan is definitely the flagship program of our Prime Minister and this government. And as you also pointed out, it started with a vigor and a lot of enthusiasm and was going in the right direction. But we have done about 25 webinars, discussions in the last 150 days. And even if you look at the international reports, even what Bill Gates said, that this COVID, whether you like it or not, is going to stay here. If even if we do best, this COVID is going to stay here till 2022 for some time at least, and we are not sure about when things will open and get back to normal. So in this scenario, when we have to live with COVID, do you think that, yes, of course, coming back with vigor and enthusiasm and taking that to that level, definitely the government authorities and along with UNICEF has been one of the biggest partner of Poshan Abhiyan, what we have read and seen. So definitely you all are working together to bring it back. But with the limitations of COVID staying here, do you think there is any fundamental change required in how Poshan Abhiyan was created and how it was implemented? And fundamentally, do you think we need to go back, step back, and look into and see how we can do best in these COVID times, which is going to stay here for maybe another couple of years?
Yeah. 2 points. First of all, Poshan Abhiyan was based on an analysis of the challenges in the systems and in the service delivery. It's trying to address this pre-COVID. It was trying to address these gaps in the systems and in the service delivery. If you do your analysis now, you do your bottleneck analysis, your gap analysis, and you want to try to come up with answers, I can guarantee you come up with the same answers as Poshan Abhiyan. We do need we have the right services, supplementation of micronutrients, breastfeeding counseling. Mothers need to go back for antenatal care, and mothers need to deliver in hospitals again. Many mothers stopped doing that, the numbers have gone down. That are the only answers we have, and they are the right answers. The problem is that as long as we stay at a coverage of 40-50%, you're not going to get your impact. We need to get that coverage back. We need the continuity of the services needs to come back. The intensity comes back. I love Poshan Ma, but why don't we have 12 Poshan Ma's per year? I love breastfeeding week, but why do we have only one breastfeeding week? So we need the intensity. And of course, we need the quality of the program.
Here is, they have diverted a lot of these people from the groundwork to COVID. And so that has affected this door-to-door campaign.
Exactly.
That is a major problem. Manpower is a big problem.
Yeah. And I think that's exactly what I'm saying. So the response is correct, but you need to do the response.
So and another thing was, recently I saw a statement from UNICEF that because the emphasis was on COVID, UNICEF slightly got strapped for cash. They're saying that more cash is needed now. How are you now in the situation? Has it started improving?
No, I think
they said they need more funding.
I think that everywhere I see it. It's not only funding, it is human resources, it's time, it's all the resources collectively as government and development partners. More resources are also being put now in the prevention of COVID, in the management of COVID. And therefore, we might have this secondary impact, this COVID-induced nutrition crisis. So definitely more resources are needed, not only for UNICEF, WFP, any development partner, also government. We also worry that resources reserved for the nutrition response are being moved to the COVID response. You already said yourself, one of the resources is the human beings, the frontline workers. Yeah. There's so many other resources. It's the time of the Prime Minister. Is he talking about COVID? Or is he going to talk about nutrition? It's the Minister of WCD. Is he going to mobilize her people to prevent COVID? Or is he going to mobilize her colleagues and her team to prevent malnutrition?
So, Mr. Vishwa, welcome to you for the second time in our HEAL.
Namaste. Thank you.
And thanks for your patience. First, why don't you, before Mr. Shankar starts shooting questions, tell something about World Food Program and the current scenario and how you are handling and what you're doing in India.
First of all, I want to really compliment HEAL Foundation for convening this event. It's really, really important, and the topic we are discussing is extremely a priority topic, and I think it affects children. It affects mass of the population. So, and it also has a long implication. So it's very important that we are discussing this in the context of the World Food Program. By virtue, World Food Program relates to food and nutrition, and our emphasis have been from the very beginning when the COVID happened and lockdown started is to make sure that everyone gets adequate food and nutrition, and there is no gap. In fact, we began with advisory support to government to say that maybe they could take various measures on that, and then within the UN system.
And my first question is to Dr. Sujit. I also know Dr. Sujit personally very well. I'd request him to explain to us how immunity and nutrition are really correlated at the biological level, at the cellular level.
It's a very debatable topic, and the heading which you have given to us is still a confusion topic, even not only for the doctors, not only for the people, the public. The entire society, the entire world is now looking behind this word called as immunity. As we know, it came from a Latin word which says an exemption from almost all the public services, which you people were discussing. So, but as we progress on the thing of immune system, there are a lot of multidimensional factors which are trying to manipulate the word called as immune system or immunity, like boosting an immune system, suppressing the immune system, etc. But as a doctor who is dealing with these type of cases, let me tell you very frankly, some of the co-doctors who are also present in the panel, with all due respect, than just increasing the immune system or boosting the immune system, as I already say, the best word to use is to balance the immune system, because we have different layers of our immune system in the human body. The primary thing is, I'm not a psychology doctor, so I'm not talking much about the mind, but the primary thing is our thought process itself. The worries and the tensions which we learn and read through the magazines, etc., even the news channels, etc. And then comes our physical body, where the skin is the factor which is primarily defending almost all the pathogens. Then comes the mucous membrane, the mucous secretions, which are trying to destroy almost all the viruses and bacteria. Then it bends, defending these areas, when it reaches the bloodstream, then the process starts to happen called as inflammation, where the WBCs, etc., the other panels happens to start.
As we were discussing, we've seen a huge sale. Everybody has been walking up to stores and picking up a little supplement to keep themselves safe or keep their immune system in high. So because you are in the formulation bit and because you've been into nutraceutical formulation, can you throw some light on what is the quality aspect of nutraceuticals? Because you're an expert in formulation, people are confused whether they should pick this zinc or whether they should eat this, or which is the best formulation combinations of nutraceuticals. So can you throw some light on the quality bit first?
Yes. So in alignment with what has all been discussed so far regarding nutrition and the inflammatory cytokines, interleukins, which are upregulated in the body during inflammation events. So what happens is that, there is a need for certain herbal elements which will help us, mitigate that stress which is induced in the body due to inflammation. So talking about the quality aspect, I would like to, introduce the concept of nutraceuticals, that how it has, emerged in a big way, and what are the regulatory bodies in India who regulate the quality aspect of these nutraceuticals. So the major heads under which these products lie are the FSSAI, who is the governing body for major nutraceuticals. And for the vitamins and the other mineral supplements, there are certain areas where Drug and Cosmetic Act and the pharma sector plays a great role.
Better tell a bit more about your excellent work, what you have done when you were at Banda, wherein you also brought into, you are also covered by Limca Book of Records for breaking some record. And then you have done an exceptional work on the nutrition front there at Banda. And you are also awarded the best election officer at that time. So a lot of big achievements and laurels, sir. So, but to start with, sir, can you tell about the nutrition mission of UP, how much it was affected by COVID, and what all measures you have taken to bring it back and how it is doing?
Actually, I will start my point from the Banda. when I went Bada, so I got a call from a journalist from Times of India. She told me, she was known to me, she told me, Vishwa, you are going as a district magistrate, so there is a problem that is called malnutrition, and it is a big problem, but nobody is knowing, even collector is not knowing. And UNICEF has done an experiment a year back, and I had covered that. So I am bringing this information to your knowledge. This was the point which made me to work on this issue. And today I am here in a position to deliver talk. So first point is that around 47% malnutrition was there in Bada, but this is not known to many and not known to even district magistrate, and nobody was serious. So first of all, the pointed knowledge given by that journalist, I made it an issue. If I used to count for the biggest problem as a district magistrate of Bada, so malnutrition, water crisis, there is a local problem of Anna Partha, likewise economic problem, unemployment problem. So within top 3 problem, I used to speak in different forums. What is the 3 big problem of Bada? Anna Partha, water crisis, and malnutrition. So slowly and slowly, first I made malnutrition a issue of public by making them aware that this is the issue which is not known to public, and if it is not known to public is not owning this issue. So first thing what I did, that I sensitized the public so that it become a issue of the public. So that is the first point on which I worked to get the success.
We have been saying that Ayurveda is, the focus is always on immunity and Ayurveda. Now we have a lot of these things coming in saying that Ayurveda builds up the immunity, Ayurveda is good during COVID times, Ayurveda is this, Ayurveda. Sometimes some people have a feeling that it is an oversell, in the sense that, you are talking about things which without much, sort of evidence. What type of evidence is there to show that Ayurveda is extremely relevant in the time of COVID?
But somehow I do agree with your point. But what I personally believe is this, okay, it's kind of a blessing in disguise, because as of now what we were doing, I'm sorry to say this, I'm including myself also, we were running in this competition and everything, running with this cutting edge things, and we somehow lost the first aim of Ayurveda, which is Swastha se Swasth Raksha. So I think somehow this scenario has brought us back to the nature, as Ms. Manjari was saying, let's get back to nature. And these herbs which we are speaking about, I mean the combination of herbs which we are speaking, let's say giloil, let's say ashwagandha, let's say other spices like salt, black pepper and pipli and other. So if we speak about the research part, so I'm really happy to say that there is plenty of research available in all the national journals, international journals, NCBI and everywhere, which proves not only the antioxidant properties, apart from that, immune booster properties and other properties. So I believe that this combination of herbs, because in Ayurveda we always say sanskaro hi gunantar dhanam. So when you combine the herbs, they basically increases the strength and the efficacy also. So I think that way it's a good thing that we have something to do, and I think it's a blessing actually, sir, because this is not something, as we all know, I mean we from India, we understand very well that these are all of our kitchen spices and everything which we, I think, forgot or lost, or the intellect, we call it in Ayurveda pragya parad, which is called as a mistaken intellect. So we knew all these things, but we somehow forgot, or we didn't put that intention. So with this pandemic situation, we at least came back to the basics, and this combination of, let's say, if it is the Ayush Quat or the other herbs, the combinations, they definitely improve the immunity for sure, sir. So at least we always say, as I said, prevention is better than cure.
Corporate trainer during this COVID times, what actually can you describe your role before COVID time and after COVID time, especially since people have been going through stress, people have been losing their jobs, there are a lot of things, multiple things happening, and it is a trainer who is actually trying to pull them back to normal life. So what have you got to say about this?
I am basically training a lot of IT folks and mid-career folks in Bangalore, both in finance, and I do take some seminars on wellness. So the problem, like Dr. Saurabh pointed out, is not just the COVID virus entering or something, it is the overall lifestyle that is also at fault. I mean, right from sleep patterns to extra stress to people always being exposed to radiation from various screens, not getting fresh air, fresh breeze, ignoring their diet, ignoring lifestyle rules, simple lifestyle rules. Sleep is a problem because they get into, night con calls. And, I always get reminded of, one of the rules of good health. It says that you should have, your mind should be completely shant and your body should be active. Unfortunately, the IT professional of Bangalore is exactly reverse. His mind is all the time overactive and overheated, and his body is completely shant. So as a result, what is happening is prana is completely blocked, and it is very, very clear that, yoga theory says that when the prana gets blocked, all kinds of diseases results. You feel the disease in the Annamaya Kosha level, but the Pranamaya Kosha rules the Annamaya Kosha, and then so on and up you go to Manomaya Kosha, Vijnanamaya Kosha. Let's not even get there. Just the Pranamaya Kosha itself is completely blocked by modern lifestyles, and we can have all the antioxidants you want. I mean, you sit, you don't move, you drop all your prana. Having Chavanprash is not going to help. First get your proper sleep, then get simple movement. Another rule for prana movement is, and it's not just Ayurveda or yoga, even ancient Chinese herbal medicine, the Taoist philosophy, it says that you have to, it's like the hinges on a door. Hinges on a door will rust if the door is not keeping on opening and shutting. Your body will completely stagnate, your energy will stagnate.
Now go to Nim, carrying further your thing about Bangalore and the stress. Nim, you are into yoga. And I don't know whether you have seen a recent study which really said anxiety among Indians is at record level, with a recent survey showing that 1 in every 4 individual is so stressed that he or she actually needs medical intervention. In such a case, how does yoga help out?
Yes, namaste everyone. Yes, definitely. As a yoga consultant here in Sikkim, I'm from Sikkim, and we have a limited hospital here. It's a small state, and with the pandemic, they have developed the fear that if they go to hospital, they might come in contact with the patients or COVID patients, and that fear and anxiety about not knowing the future. Because we don't have a vaccine that has come out already, or we don't have any idea about when the vaccine will be available to the public here. So I see a lot of clients, mostly, and also one of the reasons is due to, I think we were talking about the mobility before, and then, am I audible?
Yes, you're audible.
Yes, okay. Many people who visit and who take consultation from me, they have this depression. They are more inclined towards depression or anxiety because of not knowing the future, or maybe the restriction of mobility or freedom of movement.
Wonderful session as usual. Throwing a lot of light regarding yoga and Ayurveda, and as what Dr. Saurabh said, yes, Charaka has given us a lot of from the past. What we need is actually probably they didn't give us a working manual on how exactly this works. Probably that is where our work comes in. But people like Dr. Saurabh and Maharshi Ayurveda and others are doing considerable research in trying to get these things on board and see how exactly it works. Yoga also plays a major role in this pandemic times. And as what Dr. Gopalan has said, from the sleepless city of Bangalore, covered with glass and wrapped in their own lifestyle, I think it is extremely difficult for them. I sometimes wonder whether there is an awareness or a fad for all these things, but then Bangaloreans are always Bangaloreans. They go to an extreme, things, and you have to live in for. I really appreciate Dr. Gopan that he's lived there for 20 years. It's a city that actually has changed over so many years and keeps changing every day. So we have a lot of things to learn from this particular session, and so we have that we gain from this session. Thank you, Dr. Saurabh. Thank you, Dr. Gopal. You name. I think this was an excellent session which threw light on ancient wisdom, not only in modern times, but ancient wisdom in COVID times. I think Ayurveda and yoga has this speciality of looking at a particular problem in a multi-dimensional way and not a single track like what others are doing. I think once we address this issue in multi-dimensional way, taking all aspects of a human being as a human being, then probably we can get this solution across.